This is Dr. James with HelpMommy.com, and this is video 2 of 6 of where we're talking about a 6-month-old. And we're going to be talking about the stooling and peeing patterns of a 6-month-old. And so they should be able to handle this, but we're going to have some changes. So peeing, pretty much stone cold stable. You kind of want to know the baseline number of wet diapers that your baby has per day. Not because this is so important that you tracked, but because if your baby gets sick, it's one of the questions we're going to ask you is how many wet diapers have we had the last 24 hours? What's the normal amount for your baby? Gives us an idea on dehydration. In poop, stools are going to start changing because we're going to start adding things. So you may have a baby that starts to have darker colored stools or different colored stools. They're definitely going to smell different because we're adding foods to the mix. The only colors that we worry about are red, black, and white. Red and black because of blood, white because we're not digesting fat well. And that's something that should have already shown up by now, but we still put it in the mix. The other thing is, as we start adding solid foods, sometimes babies can get constipated. This is something, if they're having hard stools that are painful, or if they're passing blood when they pass a hard stool, this isn't something we want to have a baby do. And so there are ways that, you can cut that out. There are certain foods that are constipating, especially bananas. You get a baby that really likes bananas, you may get a constipated baby. And so the first thing I usually do is I cut out bananas and I cut out cereals. I increase things like prunes, pears, peaches, apricots, trying to get their stools looser. We may do some prune juice or some peach juice, or pear juice. That can loosen up their stools. But if that doesn't work and your baby's still having hard, painful stools, now's when you want to talk to your doctor, because there may be some things that we have to do as far as medicine to make them not have hard stools. Hard stools are, one, going to hurt, and we don't want your baby to have pain, but also long-term they can cause problems with being able to potty train your kid later on, because they associate pooping with pain, and therefore they don't want to do it. So for the most part, babies just keep cruising on. Sometimes you will see more, depending on what foods they're eating, you may see more diaper rashes, especially with some very acidic foods like some of your fruits, tomato sauce, tomato paste, things like that may, if they stay in their diaper very long, may cause them to have a diaper rash. You may have to figure out that, hey, if we're going to be eating this, we need to make sure that we have an extra layer of diaper rash cream. So hopefully that helps you in the peeing and the pooping department.